Let's go ahead and talk about iron deficiency anemia from a clinical perspective, because it doesn't matter what you know book-wise about this disease. It doesn't make any difference unless you can translate that knowledge into an actual patient. So let's go ahead and take a look at how the causes of the disease, the pathophysiology of the disease, play out in a real person, our person right here. So a person would come in and start complaining of different things that would lead you to suspect an anemia. So let's go ahead and talk about this. Iron deficiency anemia, of course, is one type of anemia, and all the anemias are a result of having too few red blood cells and or too small amount of hemoglobin in the bloodstream. So because of this, you know that there's going to be signs and symptoms which are generalized to all the anemias, and then there are going to be some that are specific to this type of anemia. So I find it very helpful to divide your signs and symptoms in that way into your general versus your specific. Now, your general ones that are again common to all of the anemias, they're the ones that are going to alert you to a problem in this person. But you're not going to be too sure of what it is, because general is common to several different disorders, but your specific, that's the one that's going to be diagnostic, and if you are taking a test on this, this is also a target for testing. So it's good to divide them this way. So under the general category, we've got several, and probably the most prevalent is pale skin, particularly in the lips and gums. And of course we know that pale skin is a direct result of this right here, that the red blood cells and the hemoglobin in the red blood cells give that red color. So without that, you're going to have a paler complexion. You're going to complain of being tired, fatigued even, because they're not getting the oxygen delivered to the body cells as they need it. And so over time, this can really wear down the person. You might see or hear them complain of breathlessness or a rapid or changed respiratory rate. And they may complain of a headache. They may complain of a buzzing in the head, buzzing in their head. Or they might complain of a fluttering in their chest. Now, why do these things happen? You can surmise that the tiredness right here is because of not being able to get enough oxygen, the fatigue as well. The breathlessness, they're trying to compensate for that hypoxic state that they're in, and the respiratory rate is the same. They're trying to balance their metabolism, their hemostasis. The headache is again from the lack of oxygen, buzzing head again, and the fluttering in the chest. There can actually be some irregularities of the heartbeat with prolonged anemias. Over here on the specific side, you might see brittle nails. These are all common to iron deficiency anemia. Cracking of the mouth, otherwise known as angular cheilitis. You might find abdominal pain, and this is from a swelling of the spleen due to the effort to try and create red blood cells. And the lower that red blood cell level gets, the harder that the spleen is working. And you might also hear them complain of restless leg syndrome, and that's where there's just a feeling in their legs like they can't relax. It just feels like they need to get up and walk. They can't lay down, they can't rest. It just feels like they need to move them. Now, the most telltale sign of iron deficiency anemia is a swollen tongue, painful tongue. Patients will complain of their tongue just feeling fat or hurting in their mouth. Once you identify this person as having iron deficiency anemia, then you can start to look for the signs and symptoms of the cause itself. So, did this person have blood loss? You would look for the signs and symptoms of that. So it would be maybe black tarry stools, perhaps pain, vomiting that has blood in it. So that would be one thing you'd look for, the signs and symptoms of that. And then, of course, you would look for reasons why this person is not getting in enough iron to make the red blood cells. So you would be looking at intake problems, you'd be looking at absorption, and so on. And so now that we've discovered some of the assessment findings of our person, we'll then turn to really trying to conclude that this person does in fact have iron deficiency anemia using some diagnostic tests. So let's go ahead and clear out this screen, and we'll review some of the tests that you might take from this person in order to diagnose them with iron deficiency anemia.